You've been in the type 1 diabetes moonshot at Startup Health for a couple of years now. Um, what's what's your experience been like? What's it been like to be part of a collaborative ecosystem and community? What's some of the experience been like for you as an entrepreneur, as a builder, as a patient?
Well, I'd say the first off, the biggest benefit is the network and just the people that I've been able to meet, whether it's the people at Startup Health or if it's the other, founders within the diabetes. Uh, it's funny, many of them are like me. They're type 1 and they came up with an idea, like you just said, patient advocacy. And so that's been really refreshing. As a diabetic for the last 40 years, it can feel a little bit lonely. Like, am I the only one going through this? And I've never really had a lot of people to talk to about my own, diabetes. So that's been really refreshing. There have been a couple of founders that I've become friends with. But beyond that, through the board, I've been able to meet very influential people, really at the top of the industry, endocrinologists and people who have sold their companies. And the knowledge that I've gained from those people, I can't even imagine where I would be, if I hadn't joined this 18 months ago. Um, it's just so much opportunity, and it continues. And also just the people they bring on that talk about their experiences and just open it up for questions and being able to bounce that off of people. And then those people sincerely saying after the call, hey, here's my email, reach out to me. I'd love to continue this conversation. um, Everyone at Startup Health is genuinely interested in our success, and I don't see that very often around the world when you're working in a collaborative environment. Or someone's like, it seems like someone's always out for another reason, that we built this because we want to make a whole bunch of money off of these people, or whatever it may be. I've never felt that way with Startup Health. It's always been just a great place to come back to time and time again. And I love the accountability. I love building, SWOT analysis, and having, Steve constantly saying, like, you need to tighten this up, you need to change this. I don't agree with you. This, you can do better than this. Um, there's no one in my life that would do that. And so, in all of his years of experience, I really value that. So.
Well, Bill, thank you for being such an instrumental part of the diabetes moonshot, and each of you as health transformers gives back and creates the momentum, the energy, the community that makes it all work. And I know how many other founders you also support and how much you're doing for the ecosystem. So I just wanted to thank you, because it takes all of us, it takes a village. So